Okay, so being 9:30, I will convene the meeting as Chair of Division 3 of the House Finance Committee. I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic in accordance with the Governor's Emergency Order number 12, which is pursuant to Executive Order 2020-04 as extended, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. However, in accordance with the emergency order, I am confirming that we are providing public access to the meeting by telephone with additional access possibilities by video or other electronic means. The committee is using Zoom for this remote meeting. All members of the committee and the staff of state agencies with agenda items have the ability to communicate contemporaneously during this meeting through this platform, and the public has access to contemporaneously watch and or listen to this meeting on Zoom or phone, following the directions that can be found in the House calendar. The House calendar has published those instructions since calendar 8 to the present 15. They're all on the Gen Court website. So we've also, in that same set of House calendars, provided access information for people to join telephonically. We are providing you with the mechanism also in case you can't access us, which is to email us at LBA_fiscal, FISCAL, state.newhampshire.us. And if people can't participate virtually, then let us know and we'll adjourn and reschedule this meeting. All votes taken shall be done by roll call. And so we can get started with a roll call attendance. When each member states are present, please also state if there's anyone in the room with you during this meeting, and that's required under the right to know law. Mr. Clerk, are you ready to call a roll?
I am.
Please go.
Representative Earth.
President, home alone, my home office.
Representative Weiler is here in my office in Concord. Representative Bean.
I'm at home in Guilford. My wife is here. She's going to be leaving shortly.
Representative Wallner.
I'm in my house in Concord, and my husband is in the house. And I should let you know, I am on the telephone and won't be able to be on a Zoom until probably after 10 o'clock.
Ah, okay. Representative Nordgren. Okay, we'll come back to her. Representative Rogers.
Catherine Rogers. I'm in my apartment in Concord, and I do have one person in my house who's a caretaker for my dog.
Thank you. Representative Edwards.
This is, excuse me, this is Representative Edwards. I'm in my home office in Auburn. I have family in the house, but I don't think they'll be coming in.
Mr. Chairman, we have all but Representative Nordgren. I think she's expected a little later.
All right. Thank you. Okay, so today, if you look at the House calendar, the House calendar says that this is a work session that we're going to hear or talk about HB 254 and HB 600. This is labeled a work session, but since the only way I've ever seen these things done is using the hearing processes of the policy committees, I plan on running this segment as though it were a policy committee. For HB 254, I think Representative Kim Rice said she was going to try to come to introduce this. And if she's not with us, then I think Representative Wallner as a co-sponsor can briefly introduce it. You're on mute, Ms. Ripple.
Sorry, I don't see Representative Rice in the audience.
So, Representative Wallner, would you like to introduce your bill?
Sure.
Let me just say for the record, Representative Waller and I talked about this possibility today, and what we agreed is if she keeps her introduction brief, that she'll be able to participate fully in the Q&A portion that follows. So, so we won't be violating any rules, I don't think, when Representative Wallner flips around on the other side of the metaphorical table and starts to ask questions. I'm sorry, Representative Wallner, I interrupted you.
Oh, thank you, Chairman Edwards. Mary Jane Wallner, State Representative from Concord. I'm introducing House Bill 254. This is a bill that the bill addresses the criteria for secure detention of juveniles pending adjudication and the circumstances in which a minor may be committed to the Department of Health and Human Services in the remainder of his or her minority. And that, with that, I will turn it back to the chairman for further discussion.
Thank you, Representative Wallner, and appreciate your joining us, Representative Nordgren. I hope everything's okay there. You haven't missed much. It'll be just take a moment to catch up with where we're at. So let's bring Mr. DeJoy on, who I think is prepared to talk at length and answer questions relative to HB 254.
He's coming in.
While you're doing that, for a sense of timing, I'm going to try to have us out of here before noon because some of us have to travel to Concord for the 1 o'clock Finance Committee today. All right, Mr. DeJoy, I think you're on mute. Okay, there we go. Good to see you again, sir.
You as well, Mr. Chairman, and thank you to the members of the committee. For the record, my name is John DeJoy, representing Waypoint. And in the issue of HB 254, I'm also representing the Juvenile Reform Project. Juvenile Reform Project has worked on modernizing the juvenile justice system for the last 6 years. And our members include the Disability Rights Center, American Civil Liberties Union of New Hampshire Legal Assistance, as well as others. I'm hopeful, Mr. Chairman, that my remarks will be brief, not lengthy, but I'm happy to answer questions as long as the committee may have them. I did submit my testimony per your request to Mr. Ripple, I believe. I'm assuming the committee has that.
So let's talk to Mr. Ripple real quick. You send us a lot of great stuff. Did you send
Yep.
Okay.
This one is on the website in case I didn't email it, but just in case, I'll email it to all of you now.
And Mr. DeJoy, did you include in your testimony that, some kind of a matrix to show us who might be future residents and who wouldn't be by type?
Mr. Chair, as part of my testimony, I provided a 2-page analysis of the data provided by the department that discusses that. The spreadsheet matrix that you had asked me to develop that I sent to you, I did not share with the committee, but I have no issue with you sharing that with the committee. And I don't intend to I intend to go off testimony. Since you have my testimony, I want to highlight a few different points. But one of the pieces I do hope to discuss is the analysis of the petition data provided by the department.
Okay, so to the committee, I'm going to be forwarding some work that Mr. DeJoy did basically at my request. And we can talk about that with Mr. DeJoy or separately. It's essentially a cheat sheet for figuring out what the impact on categories of incarceration are. And I'm sorry, Mr. DeJoy, it's going to take me another 60 seconds to catch up with where you're at.
I'm not going anywhere, Mr. Chairman.
that's been emailed. All right, I think I'm ready for you.
Okay. Thank you, Mr. Chairman. And as I said, I'm going to move off my testimony since you have my testimony. I'm going to speak to a few other points. Let me begin with a question that I've become aware of lately that has arisen. And the question is, why is this bill in finance? Now, I can't speak with any expertise to that, but I can share with the division my understanding of why this bill is in finance. It's my understanding that both the Children and Family Law Committee and the Finance Committee understood the potential impact this bill could have on the census at SYSC. Given that potential impact on the census, it was understood to make sense to consider this bill in the context of the budget. Because if the census is impacted, the budget could be impacted. And I further understand that there is some expectation that this may become policy of HB2 to travel along with whatever decisions you make in the budget. But that's simply my understanding. As I mentioned to the division previously, children committed at SYSC are disproportionately experiencing behavioral health concerns, are often children of color, and based on past suspension and expulsion data in New Hampshire, are children likely to be living in poverty and potentially homeless. New Hampshire has been historically over-reliant on institutional care for children, in part due to the lack of community-based treatment. We often hear about bad kids, we hear about dangerous kids, and the evidence of this is often the fact that they are committed at all, and the fact that they have, quote, failed many other programs. The OCA discussed brain science last week and discussed the impact of brain development on reasoning. When we consider dealing with a child who hits someone, do we imagine we'll address that child the same as we would a 30-year-old? Or do we address their treatment based on the combination of their maturity and their behavior? Any parent that's disciplined a child understands that a 2-minute timeout for a 5-year-old may mean the same as a 5-minute timeout for an 8-year-old. It's dependent on the maturational level of the child. And the same is true with addressing behaviors of children that may come before the court. We know that in New Hampshire, in many instances, children are not placed in treatment based on their needs. Children are placed in treatment where a resource exists. New Hampshire has experienced a dearth of community-based placements for a significant period of time, which is why we became reliant on the most expensive, least effective treatments, such as SYSC. The light at the end of the tunnel, though, are the system of care, the federal Families First legislation, and the proposed probation reform bill, SB 94, that's being heard today. HB 254 does not seek to remove consequences for a child's action. Rather, it removes the most egregious dispositional alternative, SYSC, from many of the available options. Now is the time to move away from this ineffective treatment model in favor of evidence-based interventions. Not only are evidence-based interventions more effective for children, they're also significantly less expensive. If I could move now to the data analysis. Has the entire division seen the spreadsheet the department provided?
Well, we get provided a lot of spreadsheets. Could you narrow it down a little bit?
So last week, the DCOF provided a spreadsheet of charges, petitions at SYSC for the years 2019 and 2020.
Do you have that access to that, Mr. Ripple? And if so, could you share it since we're about to talk about it apparently?
Mr. Chair, if you don't have the underlying data, I'm going to analyze it. You'll probably want to check my analysis against the data at some point, but I'm not sure if people need it in front of them when I speak to this.
Well, this is a public hearing, and so we haven't distributed it to the world. So
okay.
if you're gonna speak to a document, I'd like to share the document if that's okay.
Fair enough.
And putting Mr. Ripple on the spot. Sorry.
Sure. Just one moment while I bring that up.
Sorry, Kevin.
And also, Mr. DeJoy, since this is being recorded, anyone who comes in afterwards to watch it, then they would benefit from seeing what you're talking about, so.
Okay.
While we're waiting, Mr. Joy, could you, there were three things you listed, SB 94, system of care, and another thing?
The federal Families First legislation that was passed in the omnibus bill in, I believe, 2019.
Thank you.
So it's being shared now, Mr. DeJoy, can you see it?
I can.
Is this what you're referring to, sir?
It is, and I'm going to speak to an analysis of the data as opposed to any individual cell of the data. So
Your analysis, is your analysis on this form now, or is it separate?
the analysis is in my testimony. It's the last 2 pages of my testimony. And I'm going to excerpt that analysis as opposed to reading the whole 2 pages. I'll wait, Mr. Chair, until you tell me I'm ready to.
Oh,
ready
no,
for me to
we're ready
proceed.
for you. The screen is up and we're just
Okay,
waiting.
thank you. So again, I analyzed the data. The data are petitions of children at SYSC during the years 2019 and 2020. Let me start with the caveat that it's important to understand that a data analysis is not predictive. So this is not to tell you how many kids will be in Sununu if HB 254 passes. It simply gives us an understanding of the present and the recent past. So based on the 2019-2020 petition data, there's a clear picture of how HB 254 may affect the data going forward. It's important also to understand that the way these data are presented, it is each row is a single child, and all of the petitions are over in the petition list. It appears from the extent of some of the petitions that these actually represent multiple petitions for some of the children, not multiple commitments for some of the children. In the analysis, it treats every child as a separate commitment, though. So there are more than 1,700 petitions listed between 2019 and 2020. A petition is effectively a charge. Individual charges is what a petition is. There are more than 1,700 petitions listed. There were fewer petitions listed in 2020, and consequently, there were fewer children committed or detained at Sununu in 2020. Of the 1,700 petitions, were HB 254 to pass, 92% of these petitions could not form the basis of commitment to Sununu, meaning that only about 8% of all these petitions could form the basis of commitment were HB 254 to pass. The data further suggests that were HB 254 to become law, that between 25 and 50% of the children on these 2 sheets would continue to be eligible for commitment if they committed future offenses. Let me explain that a little bit because that's a pretty wide range and doesn't really say much. A number of these offenses have aggregating factors. If a weapon is used, it becomes committable. If a weapon is not used, it is not committable. That's not our decision. That's the way the criminal code is often written. If we assume that every one of these petitions that fit that criteria with aggravating circumstances, if we assume every one of them has a weapon involved, 50% of these children would continue to be committable in the future. If we assume that none of these offenses involved a weapon, in 2020, only 25% of the children would remain committable. In 2019, the number was 33%. So that's why the range between 25 and 50% based on this data. I think, the question will come up, so I might as well try to answer it now. What's the difference? What is the biggest single difference? The primary difference between current law and HB 254 is that HB 254 considers serious violent offenses as committable. It considers offenses not categorized as serious or violent, typically, but not always, typically misdemeanor level offenses, as not committable. And again, I want to stress that this does not mean that the child would not be before court. It simply means that we're removing the dispositional alternative of Sununu Youth Services Center, but the judge still maintains every other dispositional alternative, including community-based treatment, including residential care, and the others in the list in 169B.
Will you take a question from Representative Erf?
I'd be happy to.
Go ahead, Representative.
Thank you, Mr. DeJoy. Could you just explain, I didn't quite understand, you said 92% of the petitions would not result in a commitment. So that's pretty clear to understand that. What is the relationship between that statement and the 25 to 50% statement that you made?
So several of the offenses, and you can see it in the matrix that was sent out in terms of how the offenses are treated under current law in 254, the offenses have aggravating circumstances. So for example, one of the offenses is robbery. If robbery is committed with a weapon, or if bodily injury occurs, it raises the offense, and that offense becomes committable. If it doesn't involve a weapon, then that offense is not committable. They can certainly be convicted, but it is not committable to SYSC. So if we,
well, I heard those words and I understood those words, but so are you talking about the 8% that would not be committable? That would still be committable based on this bill? Or are you talking about some subset of the 92%?
So it's the 8% and the 92% are just inverse of the same thing. 8% of the petitions would remain committable. 92% of the petitions would not remain committable. In those numbers, I assumed that every robbery or similar offense with aggravating circumstances, that every one of them would remain committable. That's included in that 8% number.
Okay, so you assumed they were aggravatable.
Yes.
Which is how you got to the 8%.
Correct.
So essentially this 25 to 50% is removing people from that 8% if they did not have an aggravating circumstance.
Close. The 50% number assumes that those robberies I talked about had aggravated offenses and remained committable. The 25% assumes that the aggravating circumstances did not exist.
Okay.
And were not committable. So based on this data, the most number of children that would be committable under HB 254 based on this data are about 50%. The lowest number, if none of the aggravating circumstances existed, the lowest number based on this data would be about 25%.
But 25% of the 8%, so 2 kids.
25% of all the kids who are listed on these 2 pages is being committed. So there were 80 some odd kids in 2019. There were, in the entire year of 2019, there was 70 in 2020. When I say 25%, it means 25% of those numbers.
You're talking kids in one case and petitions in another case. Okay, thank you.
I am, and that's, and I apologize for that, Representative. That's a subject to the data. The data combines all the offenses, but then lists them by child. So yes, that is confusing, and I apologize for that.
No, I understand now. Thank you. I'm sorry to interrupt.
No.
So we have a question from Representative Weiler.
Yes.
Thank you, Mr. Chair. Would you go over again the difference between simple assault, criminal threatening? Thank you.
I will, Mr. Chair. I will caveat that, preface that by saying I am not a lawyer, so I'm going to give you my plain reading of the criminal code. There would be other attorneys who could give you a clearer idea. My understanding is that simple assault is also classified as unauthorized touching. It can cover a wide range of offenses from pushing, slapping, to hitting. My understanding is that what is the missing element is bodily injury of the victim. Criminal threatening in simple assault is as an adult and in the criminal code typically classified as a misdemeanor, not as a felony. Criminal threatening similarly is classified as a misdemeanor, is my understanding, unless the criminal threatening involves a bomb or the release of a biologic weapon, then those offenses become felony level offenses.
So, Mr. DeJoy, let's take a little pause in your testimony for a second and do a quick document review. Mr. Ripple, would you scroll through the Excel sheet that you're sharing from Youth 84 and scroll a little bit slowly so people can get a sense of it all the way down to the bottom?
I will. And if I could just add, since Representative Wallner is calling in, she can't raise her hand, but she just emailed me and I think she does have a question.
Okay, I'll come to her in just a moment.
Okay.
Mr. Chair, can I point out something just as orienting the committee to this spreadsheet?
Please do.
So in column B, those reference whether a child is detained or committed, or detained and then committed.
Okay.
Detention is pretrial.
Yes, sir.
Commitment is post disposition. I believe, I can't see the top, but I believe column C is a list of petitions for that individual.
Column D, column C is the count.
Sorry, account, right. And the D is the enumeration of those counts. Yep. And that's, those two columns are the reason that it appears that these represent multiple admissions for some of these children because of the numbers of counts. I could be incorrect. The department could clarify that pretty easily, but it certainly appears that these represent multiple admissions.
So, Mr. Ripple, would you go to the Excel sheet that came from Mr. DeJoy called Committable Offenses, HB 254? We'll switch what we're sharing. And Representative Wallner, if you're listening, we'll be with you in about 2 minutes.
Sorry, just one moment here.
No, that's all right. I'm causing you to jump around and we didn't rehearse. Or if you let me share, I can share what oh, there you go. Okay, let's go to the top here and I'll explain this one. Okay, so I've not really worked with criminal statutes, and what I needed to really understand this this bill was to understand what offenses are under current law can cause a commitment or detain status at the Sununu Center versus what of those offenses would continue to be you can incarcerate somebody over after if we pass HB 254. And so the X obviously on the far right column shows that that offense is so serious that whether it's under current law or HB 254, it would continue to be able to be incarcerate a child. And then if you'll scroll down this slowly, the committee members have this in their email. But you can see the offenses where we would be removing those offenses from the list of kids.
And the yellow highlights indicate where there is a difference between current law and HB 254.
So Mr. DeJoy put this together at my direct request because I assumed he had the insight to do it, which he does. And I needed it because I needed a simple way of understanding what we were dealing with in transitioning from status quo to 254. So Representative Wallner, if you're still hearing us, do you have comments or questions?
So I just got on Zoom.
Oh, okay.
Okay, thank you. I was having some problems here this morning. I think we're talking about the offenses at this point. What I'd really like at some point, just if John could maybe do a little more description. I think people have a hard time understanding what the alternative placements are for these children, what they would provide, why they would be more appropriate for many of these kids. I think it's hard, having had the Sununu Center as a detention center for so many years, it's hard for us to think about how are we going to move kids from that kind of facility? How do we do that? And what do these new programs, or some of them already exist, what do they look like and what do they provide the kids and why are they more appropriate? So I know you're having a discussion about offenses, and I would love to have John finish his talk about that and then maybe talk about why other kinds of programs are more appropriate.
Okay, so I'm gonna ask both you, Representative Wallner, and Representative Weiler, for some advice here. I understand that since we're hearing 254, that we should try to stay within the scope of what's in 254 and be careful not to go out to boil the ocean, because some of what you're asking, I think, may be outside the confines of 254. So since you asked the question, you must believe it's a valid question within the scope of HB 254.
I do think it's a valid question. Because I think that people have a hard time understanding, unless they've been deeply involved in the juvenile justice system. I think they have a hard time understanding what these alternatives are. And it makes a difference when they're thinking about whether they want to change who goes into the Sununu Center and who doesn't. I think they just have to understand that to make a good decision. That's just my own thinking about it. I do believe there are some there's at least one lawyer on the line that could probably help in this conversation.
Mr. Chair, Mr. Skibby, who is a colleague of mine in the Juvenile Reform Project, just texted me saying he is on the line and is pleased to speak to the legal things that I'm floundering on in terms of the differentiation between the offenses.
Okay, so I think to restate Representative Wallner's question a little bit is, and let's scroll up to the top, Mr. Ripple, please. Okay, so under 254, there's a lot of kids that could have gone to the Sununu Center that won't. I hear Representative Wallner's question to be, if they don't go to the Sununu Center, what are the alternatives, and do those alternatives exist today?
And I'm happy to answer that question to the extent that I'm able to. So the 169B19, which is the dispositional statute in juvenile justice, has a broad range of dispositional alternatives upon conviction. It runs the gamut from the child returning home and potentially receiving little to no treatment, receiving therapy in the community, receiving some type of community-based specialized treatment, all the way up to intensive in-home treatment, foster care, potentially behavioral health or mental health inpatient treatment if that's necessary. It runs the entire gamut. And what the statute says is that the justice should always use the least restrictive alternative, meaning when the children can be at home, they should be at home. What occurs many times is judges don't know what alternatives exist, and they only become aware of what alternatives exist based on data presented to them by the JPPOs. And so if the JPPO is recommending residential placement, typically that's what the judge is going to go with. I will point out that some of the treatments that I just referenced are only now becoming available under the system of care. This is where the system of care becomes important. So treatment like mobile crisis, where trained clinicians go into the community and the child's home at the moment of crisis to assess what's going on and how best to intervene with this family. That is just being stood up currently. Things like multisystemic therapy, intensive in-home treatment over a period of a couple of months, and family, the contract is out, and I believe the RFP is closed and hopefully will be awarded shortly. Those are both important treatments for the population we're talking about that they either are online or will be coming online in the very near future. They're expensive treatments, but their expense is nowhere near the expense that's budgeted for Sununu Youth Services Center. It also, the key point of it, it keeps the child in their home. You know, I mentioned that last week. What's common among all juvenile justice children is that unless they extend jurisdiction for a couple of years, all children are going back to their home when they turn 18. Judicial orders expire at 18 for these children. They don't go to the adult system unless they've been tried as an adult. So we ought to be preparing every child in the community for where they're going to be living, which is in their community. And that's why these intensive community-based treatments are so important. They're evidence-based.
Do you have a follow-up, Representative Wallner?
No, I think John did a good job describing what we need to have, where these children would go if they were not at Sununu. Thank you.
Mr. Chair, can I add one more point that I think is relevant?
Sure.
So we know from the child protection system that historically we have been a very small c conservative system, meaning that the system is not comfortable with risk and assesses risk conservatively. So it is more restrictive than it perhaps needs to be. And I would suggest that we have the same situation in the juvenile justice system, which is part of the same division. So it makes sense it's the same situation, that we're often more restrictive to a point of refusing to take on having difficulty assessing risk and not being able to place the child appropriately. And I would point as evidence of that to the detention survey that is completed before children are detained in the juvenile justice system. The department started using this, I believe, in the last number of years, maybe 14, 15, 16. And at one point in the last couple of years, more than 50% of the children committed to Sununu or detained at Sununu did not score high enough to require detention or commitment based on this evidence-based tool. Now, I know the department has revised the tool. I don't know what the rates of override are now. Override means the child does not need detention based on the scale, but is detained anyway. Those high rates of detention point to exactly what I'm talking about, is that we're uncomfortable with the assessed level of risk and defer to a much more restrictive alternative than is likely necessary.
Thank you. Representative Wallner, your hand is still up, ma'am. Representative Vert, do you have a question?
I have two questions, if you don't mind, Mr.
Go.
Chair. One's an easy one. I noted on your spreadsheet that there's one case, actually two cases, where current law would not result in somebody being committed or detained in the Sununu Center, but HB 254 would. I just wondered, is that accurate? And what is that situation?
So current law, which came about from HB 517 back in 2017, and I think I can't scroll it down. I think you're referring to burglary.
It says destruction of property appears to be one, and
Okay.
unauthorized entries appears to be another.
So entire classes in 517, classes of statutes were restricted from detention because they were considered to be non. This time around, we dug into those statutes a little bit more deeply, and that's where those statutes are where you'll see some of the aggravating factors that we contemplated as appropriate for commitment when the aggravating factor exists. That's the difference. And I think Mr. Skibby can probably give you a more coherent response than that.
No, that's okay. Thank you. The other question relates to, just to make a point, I guess, I'm looking at the governor's current proposed budget, and in the Medicaid area, out-of-home placements and community-based services, which are currently budgeted at zero, that jumps up over $50,000, close to 60, million, up to close to $60 million based on these placements, I'm assuming. Is that accurate? Is that what that increased money would be for, to get people, the kind of people that would be at Sununu, but they're not there?
That's, I believe, is broader than Sununu. I think the department could respond to that, but I believe, the placements are not just juvenile justice placements, they're DCYF placements. So it may be child protective cases, it may be juvenile justice cases. So I think that's a combination. I think the other place you'll see the dollars are in the system of care line in the Children's Behavioral Health Division. The system of care, I believe, is at budgeted somewhere over $14 million in 22 and $15 million in 23, if I remember correctly. And that is the continuation of the system of care programs that was stood up in HB 14 back in 2019. So I think it's both places are potential possibilities for placement.
Thank you.
So I think what we should do is we've sort of, none of us are lawyers, I don't think, or criminal lawyers. So I don't know that we would benefit much more from a deeper dive into the criminal statutes here. What I think we need to do as a finance committee is understand what we're about to do and understand what maybe some of the financial and systems implications are. So I would like to bring somebody in from the department at this point and to respond to anything that they've heard. And if somebody can talk to us a little bit about what they suspect a financial impact of HB 254 would be, that'd be great. I don't know why there wasn't a fiscal note with this bill, but there isn't.
So on that point, I'll just say that the bill, OLS sends us bills for fiscal notes and we haven't received one. So I'm not sure, maybe it just got lost in the shuffle. It might have just been an oversight that we didn't get it. So that's why there's no fiscal note attached. I don't see anybody in the audience with their hand raised at the moment.
Thank you, Mr. Chair.
Okay. Thank you, Mr. DeJoy. Appreciate your testimony and the work you put into preparing for today.
Mr. Skibby does have his hand raised.
Let's bring him in. I would like to hear from somebody from the department, but before we finish up.
Good morning, Mr. Chair. Mike Skibby here. I just wanted to make a couple of comments. First, with regard to the data that the department provided, my experience with this kind of data coming from the department is that it does not represent the charges for which children were actually committed to the Sununu Center. Rather, it represents a list of all charges that have at any time been brought against a child who ends up at the Sununu Center. And so it means that a typical circumstance may be that a child picks up charges over a couple of years. Most of those end up being disposed of without any placement, particularly a placement at the Sununu Center. And then eventually that child ends up either due to treatment failure and things not working out, or because of an escalating offense pattern, eventually ends up at the Sununu Center. And when they run this data for you or for other purposes, they basically list all the charges that are in the history of this child. So I think it would be a mistake to look at all of these charges and say that any one of them resulted in a commitment to the Sununu Center. The way that courts work, typically in juvenile cases, is that once they decide to impose a serious sanction on a child, they just work with one of the petitions. They don't revise the dispositions on all of the petitions that may still be active for a child. I mean, one of the weird things about the juvenile justice system as compared to the criminal justice system is that basically the disposition or the sentencing, as it would be in the adult system, basically remains a work in progress until the court is done with a case. And so there's constant revision of these dispositions, including moving a child from home into someplace like the Sununu Center. So I think it's important to understand that you're not looking at a picture of the things that actually result in commitment to the Sununu Center. I think typically only one or two of the more serious of those offenses would typically actually be what triggered the commitment to the Sununu Center.
Thank you.
I think another point I want to make is that typically what triggers commitment to the Sununu Center is not the offense, the nature of the offense itself. And one of the things that you will typically hear during discussions of how the Sununu Center has been used over the last several years is that typically there's a series of placements that are tried before a child ends up at the Sununu Center. So that typically, let's say somebody who's in there for simple assault, they'll put the child in, the probation will fail, they'll put the child into a residential treatment center, that will fail, they'll put them into another residential treatment center, that will fail, and eventually they'll throw up their hands and say, we're going to put this child at the Sununu Center. The importance of that is that you're seeing the Sununu Center being used not because of serious offending, but because of serious failures of the existing community treatment system. So that oftentimes many of these, I mean, this is getting better at a fairly rapid clip, and that's really good news for our state and for the children in our state. But typically what happens is that you have a lot of placements that have very under-resourced treatment offerings, clinical, services available. And so they end up being places where children's underlying problems are not being addressed. And so they tend to fail in a series, in a pattern, or I should say in a repeated pattern, and you eventually see kids ending up at the Sununu Center. The last point I'll make is that there are jurisdictions around this country that have basically said, we are not going to put misdemeanor level offenders in our corrections facilities. I looked at this several years ago. The one that was most striking to me was that California has that in their system. They have just said, we are not going to put such a minor offender into such a harsh setting as a corrections facility, even a juvenile corrections facility. And those those jurisdictions have survived using that practice, and New Hampshire can survive using that practice. We unfortunately have a long-standing pattern of using very harsh consequences for very minor offenses in this state as compared to the rest of the country. And I guess related to this is that what you do with a child makes a big difference in terms of their future recidivism. And it's not in the relationship is not intuitively obvious. The harsher you are, the more you separate a child from their home, from their school, from their community, the more likely it is that they will offend in the future, both as an older child and as an adult. So
Mr.
public
Stibbe,
safety suffers
if
when
you-
you do that.
Will you take a question? We have just a limited amount of time. I think what you're saying, everyone on the committee has heard similar testimony before, and I believe we all share a very common value system around it and accept it. I think a question that got asked earlier, and I've not heard an answer to, and I think we need an answer to, is if we don't put these kids in the Sununu Center, is the infrastructure built today to handle the alternative model? If we're putting kids in Sununu because we don't have good alternatives today, which I think I heard you imply, is we still need those alternatives first before we release kids into the community, into a setting that isn't ready for them? Could you respond to that, sir?
I think that the answer to that is that we are, approaching, the later stages of the build out of the system so that they will be prepared for the minor offenders that you still see showing up in smaller numbers at the Sununu Center. So that, the department is in the process of coming into compliance with both the requirements of Senate Bill 14 and with the federal legislation that John DeJoy mentioned, so that my understanding is that by the end of this calendar year, most of those improvements will be in place. And the structure of this legislation is that there would be an additional 6 months before Sununu Center would become unavailable as a sanction in those minor offenses.
So the effective date on this bill is January 1, 2022. So it sounds to me like you believe that we'll be ready by then.
That would, if Senate Bill 14 is complied with, and if the federal legislation, the federal statute is complied with, then yes, we would be ready for the effective date of this legislation. This legislation also allows for an additional period of time before detention becomes unavailable for some of those charges.
Okay. Representative Rogers, do you have a question?
No, I actually have a comment that I'd like to make. You earlier said that none of us were attorneys and not criminal attorneys. And I just wanted to remind you that I served as a prosecutor and a county attorney, and in fact practiced in the juvenile courts. So one of us is in fact a criminal attorney with experience in the juvenile courts. And I just wanted to make that clear.
No, thank you for the reminder. I did know that. I forgot that. No offense is implied. If I were to use humor, I'd say I think I promoted you by saying you weren't an attorney, but that's just.
I understand, and I won't take that as an insult.
Okay, so Representative Erf, do you have a question?
Yes, Mr. Chairman, thank you. So I think this is great, but I still have the question that I've never been able to get a good answer to, and that is, even with this in place, it sounds like there would still be a handful, maybe a very small handful, maybe just a couple of people who would still need a place like Sununu. What to do with them?
Is that a question for me?
Yes, that was you're the intended.
Okay. So I just to clarify, are you talking about the people who could legally be placed at the Sununu Center, or people who would no longer be legally placed?
No, so it sounds like if this 254 were in place, quite a few children who are currently young adults, whatever, or who are currently at the Sununu Center would be able to move out into the community, if I understand correctly, but not 100% of them. Maybe there'd be 25% left. Maybe that's only 2 people. I don't know the numbers, but let's just say it's even 1 person. What do you do with that person or those people, kids?
You mean the person who is still legally, who could legally be placed at someplace like the Sununu Center
Yes, sir.
or cannot be? Okay.
Can,
If
should
it's
be,
somebody,
yes.
well, if it's somebody who legally can be placed at the Sununu Center, then there would have to be a continued corrections like facility available, a secure placement. And I don't think anybody is making the claim that there will no longer be any need for a secure placement, because unfortunately, you do occasionally have to place someone for public safety reasons. And some children do end up being prosecuted as adults for extremely serious violent offenses. So you will need to have some capacity available, but I don't think anybody thinks that you need a 144 bed facility to serve that purpose. So I think that's the answer, is that you know, some jurisdictions have gotten away with very small, more cost-effective facilities like a dozen beds or fewer for these kinds of kids.
Did that answer your question there, Representative Roof?
Thank you.
Okay, so thank you, Mr. Skibby. For the department, about 10 days ago, I began a dialogue asking for a budget estimate of how much the Sununu Center would cost if we brought the census all the way down to 2 kids for the whole year. Because if we still need a secure facility, I was just curious what, given the amount of fixed cost associated with the Sununu Center, is if there would be any benefit to the general funds if the census was as low as 2 people for the whole year. And I would like to know if anyone from the department in the last 10 days has done a financial analysis that they could share with us now.
I see no one in the audience with their hand raised.
I'm really kind of disappointed about that, because that would be important data in the absence of a fiscal note on this. I see Representative Long in the audience. Could you bring him in? I'd like to ask him a question. Representative Long, how are you, sir? It's been a while since I've had a chance to talk to you. I'm just curious if I'm blindsiding you. I apologize for that, but what would your thoughts be if Division 3 retained this bill rather than OTP or ITL'd it at this point?
Thank you for the question, Mr. Chairman. Although I feel this is an important bill that continues on our progress with respect to juvenile justice reform, yeah, if you felt that that would be better and address, I mean, you have an important question as far as the Sununu Center. What are the savings? Personally, I'd be looking for an alternative place. We don't need the large facility that we currently maintain and heat and all that. So yeah, no, I wouldn't have an issue with retaining if that's what the committee felt they would need for better information.
Thank you. You've listened in. Do you have any other general observations from your listening in today?
I don't actually. I believe Mr. DeJoy and Mr. Skibby did a great job. That was my if testimony, I know Representative Rice asked me to be here because she wasn't able to be here. So the only thing is I know the difficulty of putting money forward today for potential savings tomorrow. I get that dilemma. You're asking the right questions, in my opinion. And I'd be interested in those answers myself. But I do believe that the state has been moving forward, and we have the luxury of other states' dispositions of these matters that give them savings and better services to their youth.
Well, thank you, sir. Representative Wallner, I'm going to ask you the same question as a sponsor or co-sponsor of the bill. Do you see what downside do you see of us retaining this rather than OTP or ITL?
Well, I guess that I would hope that if we retain it, that we will take a look at it as being in how it works into the budget negotiations that we do around the Sununu Center. I think there's a lot of people talking about the future of the Sununu Center and what other alternatives could take place. And I would like to see, if we are retaining it, I hope it's not just to do it so that we don't deal with it, but we really take it into this bill into consideration as we work on the budget.
Yes, ma'am. I hear that completely. And given that I don't have awareness of exactly what alternative settings would be required and what is being done to make them available, and that I don't know what the cost estimates are associated with the diminished census at the Sununu Center, I do think that there's information that's essential to this decision that just can be made available, but that isn't today. So, so that's what I'm thinking. But Representative Nordgren.
Yes, thank you, Mr. Chair. I agree with Representative Wallner, and I think part of the issue is there are a lot of moving parts. There's Sununu, there's our budget. I think if we can make sure we don't lose track of it, as she talked about, and the discussion is parallel to all the other discussions about Sununu, I think that would be helpful. And maybe in a few months, we'll know more than we know now. So I think that would be fine. Thank you.
Thank you. All right. Well, it doesn't, the House calendar today, oh, Representative Wallner, your hand is up.
No, I just want to remind everyone that we do have a number of pieces in the budget. I mean, we've had a long conversation about the system of care, and maybe we need to review that again as we look at this bill in conjunction with the budget, because the system of care is crucial to this working. So I mean, it's all there's a lot of interconnected pieces. So I just want to be sure we keep it available and work on it in the budget. Thank you. I think you've heard me.
Thank you. So we have two hands up in the attendees. I think Ms. Ross had her hand up first, and then we could go to Mr. Kooning.
Thank you, Mr. Chair and members of the committee. For the record, my name is Rebecca Ross. I'm General Counsel and Legislative Liaison for the Division for Children, Youth, and Families. I have sent some additional information to Mr. Ripple this morning, which was the same information that we had previously provided to House Child and Family Law that may be helpful, including some data on the number of youth that are at SYSC, the tool that the court uses as the detaining screening instrument that you heard about, and the number of offenses in this bill and their actual statutory definitions and the changes that would no longer be eligible for commitment. I'm very encouraged by the discussion of retaining this bill. I think that you'll see from our numbers that the number of youth committed is very low and has been on that trend for a number of years. Specifically, one of the pages from the data book will really show you that from 2016 till now, that trend has substantially decreased. But we have some concerns about this bill getting out ahead of the other changes, including fully building out the system of care and knowing how that's going to impact the system. I think two of the unintended consequences we may see if this is done prematurely is that prosecutors are less likely to enter plea agreements for lesser charges and have a longer and more drawn out adversary judicial process with some youth, which we don't think would be in their best interest, as well as seeking to certify more youth as adults and drag them further into the adult criminal system, when if we support things like SB 94 that would be looking at moving children and youth away from the judicial process, getting earlier assessments and diversion and treatment in the community, hopefully we'll be seeing less folks ending up in the judicial system and therefore less entering SYSC at any point in their minority. However, if we close that door too early before the other things are built in place, we will not see those cost savings, nor will we get them the services that they need to keep them out of either SYSC or later the adult correctional facility. So we would welcome having this bill retained, having further discussions about what the costs are. I will also note that the fiscal folks are working on the cost questions that you asked. I am not the person to answer that and would not want to speak for them, but there is a group of folks working on the responses to those questions that you asked, Representative Edwards, and I'm happy to take any questions.
Thank you, Ms. Ross. It really is helpful. So I'm not seeing any questions. Thank you for your testimony. And particularly thank you for letting me know that people are working on the cost estimates with a census estimate of 2 people. So that's great news. Mr. Koenig, can we bring him in?
Can you hear me, Mr. Chair?
I can. You're great.
Oh, thank you. Thank you, Mr. Chair, members of the committee. My name is Keith Kinney. I'm the advocacy director at Waypoint. John and I work together. I just want to push back a little bit on the retention of the bill. I've seen from the child advocate, Moira O'Neill, Dr. Moira O'Neill, that a small facility of 4 to 6 kids can be built and then operated for about $1.5 million a year, compared to the $13.8 million that the department is requesting. I think that the committee should understand that that's $13.8 million, which does not include $1 million they spend on electricity, which is not put in the budget, plus some amount of money that goes into overtime. You're probably looking at over $15 million a year that the state is running the Sununu Center on, which could be dropped to probably about $1.5 million to run a small facility for the remainder of those children. I think you also have to believe that there's a possibility that if the structure is built correctly, that cost could be half if it's not a completely locked facility in some way, or we can build it in a way it might be 50% Medicaid reimbursable, which means that you're only looking at $750,000 a year to run a facility compared to over $15 million to run the Sununu Center. I think I'm greatly disturbed by the idea that we won't have SB 14 up and running in the next 2 years. I think the proposal that's before the committee gives the department lots of time to finally put SB 14 and what SB 14 is supposed to do in order to protect children. I believe SB 14 can be up and running in the next 2 years, which would allow the children that are excluded from the Sununu Center to have the home-based and community-based services that they need. And let's not forget, every day this place stays open the way it's run right now with the children that aren't supposed to be in there, we're damaging these children. There's just no doubt about it that the kids that don't belong in the Sununu Center are damaged by being in the Sununu Center. They need to be in community-based services that SB 14 provides to them. Only the kids that are a danger to themselves or a danger to the community should be in a locked facility. And those children are probably less than 2 or 3 people that would end up in a much smaller facility. So I would ask the committee to seriously consider not retaining this bill. I read a quote. There was a quote from the Iraqi premier, when the Pope came to visit and they said, why not wait for a better day? He said, people will say to wait for a better day, but we must act now to get us to a better day. We have to act now to allow the HHS to get the system of care up and running in the next 2 years, and then have a small facility for those remaining children that do belong in a locked facility, but the rest of those kids should not be there. And so I'd ask the committee strongly, and you, Mr. Chair, not to retain the bill and for us to move forward. I think we can get you the answers that you want, and there would be significant, unbelievable cost savings by not having the Sununu Center open. Thank you, sir.
Are there any questions for Mr. Koenig? Thank you, Mr. Koenig. I would like to schedule an exec session on HB 254 for Monday morning at 9:30 on the 21st of March. Can you make that happen, Mr. Ripple, with the notices?
Yes.
Okay. So so to the committee members, think about what we should do. Think about if there's any amendments to this, like, for example, moving the effective date from January 1, 22 to maybe 23 or something, so that we know that we don't cut cords too quickly. But whatever, let's exec this on the 21st. If there are no other questions, I want to thank you, Representative Long, for coming in. I hope you get to tell Representative Rice that we treated her bill well. Okay, so with that, Representative Erf, your hand is up.
I think you mean the 22nd? Isn't the 21st Sunday?
22nd.
Oh, no, it's the 22nd, yeah. Yes, Monday, the 22nd. Thank you for the correction, yes. Okay, so with that, I would like to close the hearing on HB 254 and open the hearing on HB 600. I believe earlier I saw Representative William Marsh in the attendees. Could we bring him in?
Yes, he's coming in now.
Good morning, Mr. Chairman and members of the committee. Can you hear me?
Yes, sir.
Thank you. For the record, I'm Representative William Marsh, representing 7 towns in Southern Carroll County, and I'm pleased today to offer for your consideration House Bill 600 relative to funding newborn screening tests, which I filed at the request of the New Hampshire Hospital Association. New Hampshire's newborn screening program is a wonderful program, and the intent of this bill is not to change the program in any way. The issue that I have with the program is how they send out their bills. Under current law, DHHS bills hospitals for the filter paper on which blood samples are submitted for testing. The cost of this filter paper has doubled in the last year. I believe it's approximately $146 at this point in time, and it is approximately equal to the DRG payment that Medicaid pays for a hospitalized birth. And this is expected to increase as more tests are added to the newborn screening panel. Filter paper is a supply, and this bill cannot be submitted to insurers. There is no charge for the tests performed. We are simply asking the commissioner to restructure the current fee so that these bills can be submitted to insurers. Instead of billing for filter paper, the invoice could read newborn screening panel. Other states do this. For instance, in the state of Texas, effective January 1st, 2001, and thereafter, HCPCS code S3620 was implemented for newborn metabolic screenings. Minnesota uses the same billing code. An American Academy of Pediatrics document about 1-month preventative visits recommends HCPCS code S3620 for newborn screening, if not already performed, and a list of CPT codes, most notably V77.7, special screening of other inborn errors of metabolism. Coverage for pediatric preventative services has been mandated by federal law without copay or deductible since 2014, pursuant to 45 CFR 147.130. This bill does not mandate any change whatsoever in insurance law. This being the Finance Committee, it's appropriate for you to consider the alternative solution to this problem. Currently, 45 states, including New Hampshire, pay for newborn screening through fees, although some do supplement the program using general funds. 5 states and DC simply pay for the program out of general funds. In 1/3 of states, at least some general fund revenue supports newborn screening. The alternative solution, which would be equally acceptable to the hospitals, would be for you to retain the bill, appropriate funds for the program, and use the trailer bill to roll the fees back to the reasonable level they were a few years ago. Obviously, I prefer the solution presented to you in House Bill 600, but I recognize some of you may be less adverse to growing publicly funded programs than I am. Whatever solution you choose, addressing the problem will help maintain the economic viability of the various birthing centers in New Hampshire. And I will remind you all, we just lost a birthing center in Laconia at Lakes Region Hospital. Thank you, and I'll be glad to take questions.
Thank you, Representative Marsh. Representative Urf, over the weekend, it sounded like you had some questions. Would you like to ask them while you have a chance here?
Sure. Thank you, Mr. Chairman. So reading the fiscal note, it seems that part of what you're doing is shifting Medicaid costs back onto the state, or shifting them onto the state, not back onto the state.
That would depend how you structured the reimbursement under Medicaid. When we discussed this at the Rare Disease Advisory Council, of which I am chair, we were advised by the Medicaid director that any reimbursement for the tests would be cut out of the day rate for newborn births under Medicaid, which would be cost neutral to the state of New Hampshire. Any revenue that we generate from insurers, of course, will be additive to the hospitals. And that's what they're wanting, is some relief from the onerous fees they're now having to pay.
Can you clarify how it'd be cost neutral to the state? The state pays half of the Medicaid fees.
Henry Lippman said that if they paid, for instance, $75 for these tests, they could reduce the day rate for newborn births by $75, which would end up a net of $0.
Okay, I'll ask Henry about that then. Thank you.
Thank you.
You have any follow-ups there? No? Are there any other questions for Representative Marsh? Representative Wallner?
Thank you, Representative Marsh. Could you talk a little bit? I must say I was surprised when I heard that the way we were being reimbursed for these newborn screening was through the hospitals having to purchase these filter paper. Can you talk a little bit about the cost of the filter paper and what we're talking about here for that has been passed on to the hospital this way instead of it being part of reimbursements from individuals or their insurance carrier?
Well, I was not in the legislature when this was first set up. It's been done this way in New Hampshire for quite some time. The rates used to be quite nominal. I sent you a paper of what the rates for the fees used to be about 15 years ago. And at that point in time, I don't think anybody cared because they were nominal enough that it was a matter of indifference. But with the rates doubling in the last year, this has really become a serious issue. Plus, hospitals' finances are not what they were 15 years ago.
You have a follow-up, Representative Wallner?
I do, just a short one. This in no way will affect the screening that is done of our newborns. I mean, they will still all get the newborn screening. Is that correct?
Well, one of the issues we have is that more tests are being added to the newborn screening panel as more metabolic diseases become treatable. And insofar as the reimbursement remains an issue, I think there will be resistance to adding new tests to the screening panel. If we actually solve the reimbursement problem so that the hospitals are not penalized so much for the newborn screening tests, I think there will be less resistance to adding tests to the newborn screening panel. And that would be beneficial to the babies going forward.
Great. Thank you for your testimony. Thank you.
Representative Urf?
Thank you, Mr. Chairman. Could you just clarify the cost you just referenced? I was looking at did you send us more than this, your testimony as far as that goes?
I sent you one page of testimony, but over the weekend, I sent you an article from Pediatrics. Actually, I sent it to the chairman and he sent it to the rest of the committee. Okay. And I'd be glad to send it again if you would like.
No, if we have it, I'll find it there. Thank you.
So Representative Marsh, my question for you is related to my listening in on the hearing that you had on HB 600. And towards the end of that, there were a number of representatives from the insurance companies that came in and asked that we not pass HB 600 right away because they didn't perceive that they had had an ability to discuss the problem and to enter into negotiation with the hospitals. And I'm just curious how you interpreted that testimony and what your thoughts are on the subject.
Well, there are lots of insurers in the world, and it's hard to catch every single one of them. I will tell you that Anthem is represented on the Rare Disease Advisory Council, where this was first discussed before we even drafted it into a bill. And other insurers I did speak to offline, and the general reaction was they got a pretty good deal for a great many years, and they were happy for that. We're not asking for a change in insurance law. The federal law is quite clear on the subject, but nevertheless, there's always somebody who didn't get the message and comes to the hearing. I understand that.
Thank you for that. I appreciate your answer. I'm not seeing any other questions for you at this point. Thank you for introducing your bill. We have two members of the audience that want to join us. Let's go with Dr. Chiarella first and followed by Mr. Lippman. I think that's the order they raised their hands.
Can you hear me?
Yes.
Thank you. Thank you, Representative Edwards, Chair, and good morning. For records, my name is Dr. Sai Chiarella. I'm the Bureau Chief for Population Health and Community Services. I just want to thank Representative Marsh being a proactive and collaborative partner at work with us on these issues. And we just want to be very clear that the fees actually is meant for the program work. So it supports, has put in the legislation, the fees that we collect, it's currently $146 for each filter paper. And that actually covers all our work, basically the staff, as well as our operational costs for the program, as well as the lab testing costs. We currently conduct around 37 conditions. We test for 37 conditions, and all of these conditions are currently covered. These are provided on the federal level. These are like the required kind of conditions that we need to screen for. So for like almost 2 years ago, our cost for filter paper was around $46. And in the last year, we added almost like 4 conditions that actually increased our cost to almost $146. So I just want to point out that it's not for any other purpose other than the testing and the cost of maintaining the program. Those filter papers cost is used for.
Thank you. Are there any questions for Dr. Chiarella? I'm not seeing any. Thank you for your testimony and your time here today. Mr. Lippman has his hand up.
Good morning, Mr. Chairman, members of the committee. I hope you can hear me okay.
Great. Thank you for coming today.
Thank you. Representative Marsh's bill here is something that the Medicaid program supports. The filter paper is effectively a means to pay for the testing that was described by Dr. Chiarella. Since the discussion of this bill began, that we've lost actually 2 places where women can deliver babies, both the Lakes Region one that Representative Marsh mentioned, as well as Parkland and Derry. I think the department's very concerned about the maintaining network adequacy. This bill, in a small way, it contributes towards, fairly allocating the cost for this vital service. Even with the reimbursement that Representative Marsh talked about, the hospitals are still helping to subsidize the availability of a program that, is not just a medical issue. It's a long-term cost to the state and all the different programs that support people who have those conditions. So I think it's an appropriate bill. I would just footnote that in our fiscal note, we were thinking that it could be implemented with the support in the Medicaid program. The fiscal note contains, I think, a $225,000 total funds estimate. It could also be implemented as the way Representative Marsh said, it could be just netted into the DRG payment for the delivery. But I think in terms of Medicaid covering its fair share on this, I think the way we have it described in the fiscal note would be the way I propose we do it.
Are there questions for Mr. Lippman? So I have a couple questions about this. Would the department be able to implement this law if passed, given that the effective date is just 60 days after its passage, after the governor's signature, potentially? Is that enough time for you to adapt to the change?
I think we can do so. We would need to file a state plan amendment if we implemented an increase in payment. And it could be, if it was passed in July, we could file something by the end of September to, I think, cover this. And that would allow us to be able to do that. I mean, there's also a small amount of computer programming. I think we pretty much be able to do the 60 days after.
If you were to recommend a number of days after passage, what would you professionally recommend so that your department can absorb this change, to include the IT reprogramming?
Sure. I think 90 days would be a little bit, given all the other things that are likely to come up out of this session. If this were the only thing, I'd be very comfortable with 60, but I know there's more coming our way. But if it needs to be 60, we'll do our best.
And then to Representative Marsh's observation that he thinks to the state budget that this would in effect be cost neutral. Do you agree with that observation? And if not, are you able to tell us, since we're in the heat of the budget battles, what the impact would be on, say, the governor's proposed budget?
So it could be implemented as Representative Marsh described, but since Medicaid is a significant provider of delivery of babies in the state, and particularly in the more rural parts of the state, and those are the more challenging areas where keeping a place open for deliveries is even more challenging. I think that we had included in our fiscal note the anticipation that we would pay the $75 as described in the bill, and I think the fiscal note says $225 in total funds. Again, I think in terms of what it's going to mean to us if we don't keep all the places open that are now still available, particularly in the rural areas, this is a very small investment that will help contribute. I'm not saying it guarantees anything, but I think unfortunately it's becoming more and more challenging as the number of births are fewer, and as Representative Marsh said, this has been a challenging time. And I think even with making some payment, the hospitals are probably still contributing historically what they have contributed towards this program, and it won't cover their full cost.
So a couple times in testimony, it's been implied that if we pass HB 600, it'll be it could potentially be a key thing to keep any of them from closing, and that's a little bit of a stretch to me.
Excuse me. I would agree that in and of itself, it would not be the determining factor, but certainly, there's evidence if you just look at it in terms of, if you look at the map of where to deliver children, it's really declined quite a bit over the last 5 years or so. There's, for example, Littleton Hospital in the North Country is, were it not for, I think, some CARES Act money would have ended up closing as well. And so I think we really have a network risk here. And this is probably one thing that we can do now. There are probably other things we'll have to do in the future to maintain reasonable access for people in our state.
So I appreciate that. And as I think about the DHHS testimony that we've heard, I don't recall anyone telling us that we had a potential crisis of birthing centers closing. And as a result, I don't recall any programmatic effort to address that. And I know it's bigger than DCYF, but I'm just curious on your thoughts on whether this should be more of a departmental priority, something we got our eyes on instead of just talking about in background.
Well, I think that the department has actually been, the Commissioner of Insurance and the Commissioner of HHS have been in conversations about the concern, because I don't think Medicaid alone is not going to be the way that that facilities are maintained in the state. And so I think that while it may not have raised to a legislative level, public health, looking at, there's been in the media about births being done on the road as opposed to, in facilities, that there is a concern here. And I think probably the COVID situation has kept both commissioners pretty busy in terms of elevating it to a higher level. But that certainly is an issue that we're if we lose Littleton and we lose one other rural one, we really have a problem in terms of access. And again, this is not trying to oversell this particular provision as being the answer to it, but I'm just saying we have work to do to avoid a crisis.
Thank you for adding that perspective. Are there any questions for Mr. Lippman? Okay, I have a question for Representative Marsh. Would you have any objection to us changing the effective date from 60 days to 90 days?
I have no objection to that.
Okay. I see lots of hands up now. I'm going to do Ms. Minahan and then Ms. Dunlap, and then we'll come back to Dr. Chirella.
Good morning, Representative, members of the committee. Can you hear me?
Yes.
Great. For the record, Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association. I don't really have testimony per se. I wanted to be available for any questions anyone may have. And I actually want to thank Representative Marsh on the record for being so supportive of this bill and really helping us to kind of shepherd it through and working with through the Rare Disease Council. As he mentioned, he has been very transparent with what the bill does and getting input. So I just wanted to acknowledge that and thank the department as well, both Dr. Chirella and Mr. Lippman. So I am happy to answer any questions. And again, this is just kind of an effort to just kind of not right or wrong, but just to address the ability of the hospitals to be able to recoup some of the costs associated with this program. Again, as Representative Marsh and Dr. Chirella has said, this does not change the structure of the program at all. But as she also indicated, it went in, as Representative Marsh's information he shared, it went from $18 to $40 to $71, and now it's $147. So it's more and more expensive. And again, there is an opportunity, as other states have done, to change this from a supply, which just gets rolled into the DRG or the diagnostic grouping that they bill for, or you can just bill it as a lab. And this just is allowing that to occur. That's really all this does. But I'm happy to answer any questions.
Are there questions for Ms. Minahan? I have one for you. Do you think that the New Hampshire Hospital Association is currently engaged in a strategic conversation with the department or others to address the crisis in childbearing centers. I know that's not the right term, but you know what I'm saying.
Birthing centers,
Birthing centers.
hospitals and birthing centers. Yes, in fact, Mr. Lippman has reached out to Mr. Anand, our president, of the association to have these discussions, and we are in doing some research to provide some information back to the department. And like Mr. Lippman said, it's a broader discussion that we actually have been having. It's very complicated because it involves quality of care as well as the financial impact of having a birthing center within a hospital, and the change in our demographics, especially up in the North Country. It's a really complicated issue, but access to care and ensuring that we have adequate network for our birthing centers is extremely important to everyone here, certainly in our hospitals. So yes, we have, to answer your question, we have begun those discussions.
Excellent. Thank you so much. I hope everyone stays engaged with that. It sounds like we have a problem we need to deal with. All right. So are there other right there you are, Representative Weiler. Question for Ms. Minahan?
No, just a note to you, Mr. Chairman, I have to go to another committee at 10 after and cover a vote. Thank you.
Do you have any questions for anyone before you go? Or
nope, it sounds like it's going along very well.
okay, I would propose that we exec this also on the 22nd. Do you have an issue with that, sir? All right. Thank you. Ms. Dunlap, do you have your hand up? And thank you, Ms. Minahan. Appreciate it.
Thank you. Thank you, Chairman.
Hello, thanks so much for bringing me over. This is Sabrina Dunlap. I'm Director of Government Relations at Anthem. We did testify on this bill originally. We're really just kind of puzzled by it because we have not heard from the hospitals on this issue. I checked with our contracting folks, and typically this is something we would have heard about before. And so I can say I'm really still unclear on what the need is to legislate this issue. So, you know, we've said that before, and still listening to others speak on this, I still don't know really why this is needed. Again, this is something I think we would typically engage in with contract negotiations, and this has not come up. We did not know this was coming from the hospitals. As Representative Marsh mentioned, our medical director does sit on the committee for rare disease, but I couldn't quite hear what he said, but I heard something like we got a good deal. I'm not sure what that meant, but I can say we were not prepared for this bill to come out of, you know, even though our medical director's on the rare disease committee. So I'm not sure what that suggestion was because I couldn't quite hear. But anyway, just wanted to clarify that, you know, we're generally just puzzled by this. And again, I'm not sure the connection to, you know, the cost of these strips to birthing centers closing. I'm not sure that that's totally accurate. It seems like a bit of a stretch. So anyway, thank you so much for letting me testify on this.
Thank you for coming in, Ms. Dunlap. Are there any questions for her, for Anthem? I'm not seeing any. Dr. Torella, welcome back.
Thank you so much, Representative Edwards. I just want to follow up on the timing of it. Given this legislation sits and we might have to do some rule changes, so we might need some time. So I just want to bring up that to the committee just from a timing point of view.
We're a finance committee. You have to tell us numbers. How much time?
I think the proposed 90 days to 120 days would be a good timing, just given where our schedules are, specifically with the impact of COVID. So that's the reason I'm asking for that time. Okay. Representative Marsh, I think you're still on, sir. Do
would you have an objection to 120 days?
I really don't. This problem has been building for years, Mr. Chairman, and I think that the hospitals will be happy to see that we are reaching a resolution to the problem. And whether it happens in 60 days or 120 days, I don't believe is critical.
Thank you, sir. Anything else, Dr. Trella?
I just wanted to add to the conversation about the birthing hospitals. We in public health has been keeping track for the last 10 years on the closure of birthing hospitals. And we recently started doing 2 years, we have been doing a research proposal with people up at Dartmouth, some of our OBGYNs, as well as from RWJ. Some of the funding is coming to support some of the understanding. And we have been doing some focus groups. And some of that information actually is being funneled to our department to talk about, what kind of issues, where those things are. And we have been tracking this issue, especially from what kind of perinatal care the families or the moms are getting, so that way we can understand what the long-term impacts of these the closures would be on the future of New Hampshire.
Good. I hope everyone keeps collaborating with one another and looking for some solutions. It's important.
Yes, we have been.
Healthcare
Yes,
system.
this is a departmental priority for us.
Are there any other questions for Dr. Trella? I don't see any hands up in the attendees. So what I would ask you to do, Mr. Ripple, is to put in an amendment in, and you can put it in my name if you, just to keep it simple, changing the effective date from 60 days to 120 days. And we'll exec that on Monday, the 22nd, after HB 254.
Sounds good.
That's my plan. Are there any comments from committee members? If you have other amendments or thoughts, please reach out. Otherwise, no, we'll have a full committee discussion on the Division 3 conversation on Monday, the 22nd. With that, I think we're ready to adjourn on HB 600. Thank you, Dr. Marsh, and everyone for coming in. And
Thank you.
Thank you. So the rest of our time on the House calendar was scheduled for work session. I don't have anything prepared for this work session other than to say that I should have known, but I really became re-aware of 3 HB2 notes when the Veterans Home talked to us yesterday. They're in footnotes, but I guess they're also in HB 106, 7, and 8 respectively, I think. And we need to schedule a discussion and vote on those. I think we could, those are pretty, I'm guessing that those are pretty non-controversial. So I would like to add them to Friday if we could, those sections, so that we talk about them Friday and try to vote on them. So, okay, this is the time of a committee meeting where it's open to any committee member for the good of the committee. Do you have any questions, comments, concerns? Representative Wallner? You got your hand reaching to raise your hand, and you're on mute.
You saw me. So yesterday you presented us with a new budget document. And I have concerns about that at this point. Basically, it was one person or two people or some group of people's idea of how to rewrite the budget. I mean, now it's called the baseline budget. And in about an hour and a half from now, we're going to have a public hearing on House Bill 1. And the public haven't seen this new document. So I think a lot of the testimony will be around House Bill 1. Obviously, that's what the hearing is for. And without them knowing that there is this new document out there, I'm really concerned about us sort of changing horses at the end of the race here. if there was going to be an alternative kind of budget proposed to work from, I think it should have possibly been, and I've never seen this happen before, but I think it might have been where it should have happened, would have been that House Bill 1 should have been that document. And that way everyone would have a level playing field for knowing how to proceed. So I do have concerns about it. I'm also concerned about areas of the budget that are quite complicated. And I think we just spent like 3 or 4 weeks going through the budget, both House Bill 1 and House Bill 2. We've come across some very complex issues, and I'm worried that they will get lost, or some of them could, the potential could be there for them to get lost in this new way of budgeting. I mean, I understand why there is the desire to do this, because it's adding back and it's being positive and it's saying yes, instead of saying that you need to do some reductions to the governor's budget. And that desire to not be cutting the governor's budget. I can understand why this has come about. I'm just concerned that everyone doesn't have the same information and they aren't all working with it at this point. And I'm also concerned about what kind of a workload is this putting on the LBA? Because is this document going to be loaded into the budget system? In the end, won't we actually be having a House Bill 1 that will show possibly reductions in certain areas? So I'm just putting those things out there. I know in about an hour, like I said, in about an hour and a half, we're going to have public input. And I don't think many people in the public even know about this new document. And so you might have people who are asking to not have their line, to level fund their line, only to find out that in the new base budget, that line from the governor's budget is much reduced. And so they should be asking to add back to the base budget. I think it's got a lot of confusion, a lot of potential for confusion for people. But whatever we decide to do, however we decide to do it, I'm here to do it. Thank you.
Representative Norgren, do you have a comment there?
Yes, thank you. I agree with what Mary Jane said. I also think it's very complicated that the first year of the governor's budget is his proposed budget, but the second year is the same as the first year. So that's a lot of different typing problems for LBA. And I think that's, as Mary Jane said, is just going to add confusion to the people who think they're testifying on a budget they have seen from the governor in the second year, but now it's not. So I just wanted to add that comment. Thank you.
Thank you for that. And just to respond to maybe partially to both of you, and if I don't complete the circle, please bring me back. To the very fair point that we may be overloading Mr. Ripple and Mr. Felstad with a lot of changes. I've begun to talk to Mr. Ripple, explaining to him that I don't know the tools that he has available to him to manage our HB1 changes. And I don't know, therefore, if I don't know the tool, I don't know the workload that's associated with that. And talking to him a little bit, I think I understand that that if a line item is in the governor's budget, then and we don't change the governor's budget, then it's easy. It's already done. And it's any changes other than that, to, like, for example, if we went back down to a FY21 base number, that would reflect a change, and that would be, that would require updating manually by either Mr. Ripple or Mr. Felstad. Is that right, Mr. Ripple?
Yes, that's correct.
Okay. So I am sensitive to the idea that if we can accept the governor's budget line, that works for the transparency reasons that Representative Wallner and Nordgren have mentioned, and it works also for the administrative sake of the LBA. And if we get to the point where we're looking at lines and we're choosing between a few $1,000s here and there, I think the bias would be to keep the governor's proposed number. In fact, what Representative Irf and I have done in conjunction with the Republican caucus really is we've taken the FY21 budget. That's a public document that's out there. In order to improve visibility of FY21, we added back the HB4 items that aren't transparent. I mean, they're technically there in the public view, but because those HB4 items aren't brought into HB1, we lose visibility of them. So when I refer to an enhanced FY21 baseline, that refers to what the budget is in the current year, plus the add backs from HB4 to give us a clear view on what the dollar amounts are. So we don't, as a Division 3, have a proposal on our budget until it's the 24th or maybe a little bit earlier. As I understand it, the budget that comes out of Division 3 is never the same as the current year, and it's never the same as the governor's proposal. It's always a different thing anyways. So we're going to get to a different thing anyways. We're just going to do it from a process of using the FY21 enhanced baseline, meaning HB4 is brought in there. And then we're going to take a look at the governor's budget and see how much money is freed up by looking at the Ways and Means estimates versus FY21. And then we'll be in a position to support the priorities we think are important. And I don't know, fundamentally, I see that as the process that every Division 3 in history has had to do one way or the other. I'm just maybe changing the order a little bit, but I think it's transparent in the sense that we're using the current budget. We're making it more transparent by adding the hidden HB4 items. And we're taking a look at the governor's budget, and we're trying to figure out the governor's budget assumed about 77 million initially over the biennium, more than Ways and Means. So fundamentally, our task was always going to be hard. It was always going to be, the governor had $77 million in the biennium that we didn't have the luxury of investing. And, and when asked to help us with that $77 million difference, we were told by the governor's office that it was really, their work was done. They think our revenue estimates are too conservative. And since then, they published another letter saying they're expecting yet more revenues, and they've requested more investment in various priorities. And so, because we're bound to live within the means that Ways and Means gives us, we can never reach what the governor is proposing. We just can't get there. So I would rather have us focus on the positive conversation of saying, okay, given our current year, we accept that the current year's budget was passed by the majority 2 years ago and represents the spending priorities of the majority 2 years ago when they went through this process. We recognize that FY21, the current budget, is something like 24% more than in FY19. So there is a rather large increase in spending from the prior budget to the current budget. In my experience, when an organization experiences that much growth, it's very hard to maintain efficiencies and effectiveness. And so when you couple the pandemic and you couple the workforce shortage, I think it's okay to start with an FY21 base because they haven't grown to the FY21 level as it is. So it still represents a growth from them from where they are to what the current budget envisioned them to be. So even if we were to freeze FY21, it would still represent real growth in DHHS from where they're at right now. But nobody on our side is proposing freezing FY21. We see that there's a possibility of taking about 100 million, about a third of it in the first year, the other 2/3 in the second year, and adding that back. And I think we're essentially going to have to blaze our own path because we can't follow the path the governor pursued because his revenue estimates were so much larger than the ones we're allowed to work with. So we're kind of starting where the governor started using the current budget. From here, we have to blaze our own path, and we've got resources to invest above the FY21 enhanced baseline, and we may have more. We've asked Ways and Means to come back and give us a confirmation on what they think their best guess at revenues are on the 23rd of March, if not sooner. So, but we're never going to have as much as the governor is assuming. That's a very long answer to your question, but I'll give you back the floor, Representative Wallner.
Thank you. So I realize you'll never have as much revenue as the governor had in his budget unless the Ways and Means Committee decides that they would like to reevaluate their revenue estimates. So I understand how that works. I understand it very well, how that works. But in the end, won't the Finance Committee budget, the budget that will be published by the Finance Committee, it'll be HB1 as amended by the Finance Committee, be lower than HB1 as it was introduced, which was the governor's budget. And as I heard yesterday, Representative Weiler talked about, I think it was $70 million that would be, that we need to look for reductions in the governor's budget. And he laid out how they might be divided, in Division 1 having some, Division 2, and Division 3 having someplace in the neighborhood of a $50 to $55 million reduction. So in the end, won't we see published a budget from the Finance Committee that actually is lower than what the governor brought to us because our revenue estimates are lower?
I'm going to leave that conclusion to kind of the statement of the obvious that you just made, but I would just tell you that I see it very differently. I'm seeing that we have a current year budget that's almost 24% greater than the higher budget that preceded it, and that we're going to use that baseline of FY21 and we're going to grow it more in the Division 3 recommendation to the Finance Committee. It won't reach as much spending as the governor's budget has proposed because, as you said, we fundamentally are dealing with a lower revenue estimate than the governor. And it isn't that we wouldn't spend it as the same amount of money in the same way as the governor. It's just that our rules don't allow us to do that. So I choose to characterize what we're doing is we're taking a current budget, which is greater than what the department has been able to absorb in the first place, which if they went from where they are right now on the 11th of March forward to the end of the year, they'll never get anywhere near the FY21 budget. So just if we used FY21, it's still growth from where they're at. And we're not going to be satisfied with that. We're going to take that growth that's still there and we're going to add potential growth to the tune of about 90 to 100 million, roughly split, 1/3 in FY22 and 2/3 in FY23. So I'm sorry I'm not just giving you a yes or no to the way you frame the question, but hopefully my answer is my answer and that you understand it.
Thank you. This is just a technical question and probably maybe for Kevin. Are we going to be having the document that you shared with us yesterday? Is that going to be available to the public? Is it going to be on the website?
Well, I think I told him yesterday that because it's an internal working document at this point and that it's based so strongly on FY21 that I didn't see a need for it to be a publicly shared document because it's like in progress work notes. It's not our proposal. When Division 3 votes in a week or so, our proposal is going to be about $100 million more than this working document shows. If the community wants to provide input and feedback, they can look at the FY21 existing budget and tell us what they think about the FY21 budget and how they think it should change between now and the end of FY23. Now, that's how I view it. If the LBA in consultation with all the right to know people think that this working document it's going to change daily anyways, needs to be hung on the website, I'm okay with that. I just think it's going to cause more confusion than it's worth. So since I just answered the question, why don't you tell me the real answer, Mr. Ripple?
Well, the real answer is we haven't really come to a conclusion yet. I did discuss it with Mike Kane, and he said that since it was a working document, there was no need to put it on the website. But it doesn't have to stop there. I could contact House Counsel. I could contact others to decide what they think our obligation is to make it public.
So just because I think it's really important to all of us to be transparent to the public, would you please pursue that to the next level of legal review?
Okay.
Representative Wallner, do you have a comment, question still?
Well, I still think there are people out there in the public. There are a lot of people in this state who follow the budget very closely. They know different sections of it. I think they are going to be confused by this new way of operating here right at the end, and they need to at least have access to seeing the document. And I do hope for sure that we are sharing this with the department, because there are some serious ramifications here between using 21, the budget of 21, and not the document that we have been using all the way through and that the department has been responding to. They've been responding to House Bill 1, the governor's budget. And what I mean, it sounds like what's happening here is we're saying, we're not going to use the governor's budget. We're just going to set that aside. We have a different document we're going to use that we're going to build from. And I just think we need to be sure that everybody's got the same tools to be working with. So, thank you.
Thank you. And I hope that all of us can understand the concept that we're using and can help explain it to the public so that we dampen any confusion. This is a fairly standard budgeting process from my experience, where if you have to do a budget, you take a look at your existing budget and you make changes from your existing budget. I think that's pretty standard. And I don't see a tremendous value in using the governor's budget because we'll never have enough money to feed the governor's proposal. So let's focus on what we can control, which is growth from the current budget.
Could I just make one more comment?
Yes, ma'am, we're having a conversation.
Okay. I guess it's, I've been around a long time, so sometimes it's hard for someone who's done it one way to make that change. But you know, the department has there's a department process that took place starting last summer. And they proposed what they felt was appropriate for the departments and for them doing their work. They proposed that to the governor. Then there's the governor's phase, and he then, or she, does a lot of work on the budget and comes forth with the governor's budget. And I'm worried that a lot of that work is just being set aside, and we've just spent 3 to 4 weeks using House Bill 1 and House Bill 2 as they were presented to us, as how we've gathered all our information. So it's just at the end of the process like this to be given a whole new document to work from. There are a lot of people here, not just the people on Division 3, Division 3 might be able to handle doing this, but I think there's a lot of other people that have a lot of concern about how the budget comes out.
I think we're all extremely concerned how the governor's or how this budget process works out, and that we all want the best Division 3 budget that we can produce. And I think all of us have unanimously accepted the idea that we don't have as much revenue to put into the budget growth as the governor did. So ultimately, everyone who's been involved in this process on a day-to-day basis since last July probably already knew a long time ago that the Division 3 product was going to be at a different level than what the governor's process led them to. So I don't think we're springing any surprises on anyone. Representative Nordgren, your hand has been up the longest, I think.
Thank you very much. Thank you very much. I think what we need, one question I had was a process question. Are the other divisions doing the same thing? Are they writing their own budget too? Or are we the only division doing this?
Well, as I understand Division 1 and Division 2, their numbers are going to come up somewhere between FY21 and the governor's proposal. So their end result, they're going to get to the same result that we will. We will be between FY21 and the governor's proposal, because all of us have less revenue than what the governor was able to use in his assumptions.
But in reality, Division 3 is writing a whole new budget of their own. are the other divisions rewriting the governor's budget line for line?
I guess I don't agree with your characterization because we're using an existing FY21 baseline and we're adding back HB4. We're using real numbers that have been really approved by the prior majority. As the process has been described to me, being in the minority could mean having the majority show up with a budget on the last day and not allowing the minority to participate in it and just taking a vote and pushing it through based on numbers. And I am attempting a very, what I think is a very collaborative process. It's a very transparent process, when I think an alternative approach would be to spring a budget at the last minute and call a vote and let the vote decide what we're going to do. I don't want to do that.
So we got a document from Representative Earth that was, I think, 80 pages. And what it showed was the governor's budget for 22 and 23, and every line was the same. So the second year of the budget in every line is the same as the first year of the budget.
Yes,
so are we going to be going through every line of the budget? Or I guess I don't understand how you write a new budget. We've never really written a new budget before.
So again, I don't agree with the characterization that's a new budget. It's the FY21 budget with the add backs of HB4 for full transparency. And then since we're using a working document, we had an algorithm that got us to FY22. And because it's a working document, we said, okay, for now, just carry FY23 as the same number as FY22, but we all know we're going to add back money, and that we have money to the tune of $90 to $100 million, of which in the first year, 22, we can add back around 30%, a third of it, and 2/3 in the second year. So by the time we get done, we will probably have in every line growth between 22 and 23.
So will you pick a number, an amount of money that we can add back in, and LBA will keep track of that and subtract each day how much money we're putting back in, or how does that process work?
I think it's a working document, and a bunch of the add back ends we can kind of keep track of as ourselves, because we can use an Excel sheet and figure it out. But the LBA will be receiving regular updates, and I will try to distinguish for Mr. Ripple, which accounts are ready to be locked in, and that's going to be the result of some of the votes we're going to take. Like, for example, yesterday, we decided that we would ask Mr. Ripple to give us all of the accounts that had federal funds only. And we're going to vote to, I think, to accept the governor's budget on those federal lines, and that'll put a portion of the work away. As we go through the budget in the few remaining work days that we have, we're going to try to agree on some areas. I think we probably are all very close to agreeing on the veterans home in Glen Cliff, for example. And I forget exactly, like, if you will tell us what line the health equity line was that you suggested that we agree to, we probably will agree to your proposals. I do want this to be collegial. I do want your input reflected. I do want this to be a transparent process. I do realize that there's an alternative where we could spring something on you at the last moment and just go straight to a vote. And I don't want to do that.
I just worry that the public will be totally left out of this, not knowing today when they testify that they're testifying on hopefully having their certain line item put back in the budget, because now none of those are in.
I reject your terminology. These things are already in the budget. They're in the FY21 budget.
All right, thank you very much.
Representative Rogers, your hand has been up.
In fairness, Representative Erf's hand was up before mine, but I'm happy to go. I have a few questions. If we're bringing in written amendments, should they be worded to amend the document House Bill 1, or should they be worded to amend the Representative Erf's document that he gave to us? Those lines, how do we want to do that?
So if you're amending HB2, we have a schedule that we've shared talking about which sections we're going to talk about on each day.
Right, I'm concerned on House Bill 1.
Okay, if you have a proposed amendments on House Bill 1, I'm not actually sure exactly how that level of detail works. I have imagined what we would do is we would be talking as a committee, Division 3, off of an Excel document and deciding on HB1 how we want to invest the resources we have available.
So you're not going to require written amendments. We could just talk about them if we.
I want this to be a collaborative process, and I think discussion and brainstorming is best done if we've got a live Excel sheet, and then if we can get comfortable that we've resourced it properly, at that point I'd turn it over to Mr. Ripple and say, please make this an amendment, and then we're ready to vote because we've already had the discussion.
Okay, I just wanted to make sure how you wanted to do it. The other concern that I have is, and I know that perception is sometimes reality, but my concern is that when we come out with the document that yours and Representative Erf's document as our proposed budget, and we're not any longer using House Bill 1, that your explanation needs to be a little bit clearer, because I fear that the public will look at this as somewhat of an obfuscation. And I'm not saying it is, I'm saying perception, because the document has not been released to the public. So I would urge you and urge Mr. Ripple that to err on the side of caution. And to, as I understand you're saying the document will change rapidly, but releasing it to the public could go a long way now to reducing anything in the future of people saying that it's an obfuscation or ability to hide or the last minute. If the sooner they have that document, even if it is going to change rapidly, then you take away any kind of possible people saying they didn't have it, they didn't know it was there, and so forth. So I would urge you to err on the side of caution by releasing it and putting it on the website at least. I don't see where it's a problem that anybody sees it. Even if it might be out of date, the minute you put it on there, at least it's there that people see the document we're working off of at one point. My grandfather always said the only thing that does well in the dark is cockroaches. So I think it might be helpful to put it on there so that people can see what we're working off of. And just because then people won't, when they can't see something is when people complain and put all kinds of people's motives for doing it. That's just a suggestion.
So I've found that you can never communicate perfectly to 100% of the people anyways, and people who choose to look at something negatively, or they're going to exercise that choice. But I just want to put the next 8 days into context. The next 8 days is a tiny drop of time between when the FY21 budget was approved 2 years ago and HB4 got approved on top of it. The working document that we're using does us a favor by taking that HB21 existing budget that's been out there for 2 years and merging into it the HB4 items that have also been out there for a couple of years. So it gives us visibility into what's been there for 2 years. When we finish our work in 8 days, we're nowhere near done. The state's nowhere near done. Our Division 3 work will go to a full finance committee a week or so later, where public comment can be reached. Then from the finance committee, it goes to the whole House. If the whole House passes it, it goes to the Senate and goes through all of this process all over again. And then it goes into the committee of conference, which is probably more in the dark than anything we're doing. In the next 8 days, everything we do is going to be broadcast live. So in terms of transparency of the work performance over the next 8 days, I think we're going to be extremely transparent. And because I agree with your point, things don't, sunshine's the best disinfectant. So did that address your concerns? Maybe not in the way you wanted me to, but I think, what do you think?
I just think the more you put in the public view, the better, and I would urge you to put the document in public.
Thank you.
That's all. Thank you.
We have a lot of work in the next 8 days, and things are going to be changing so much that it actually in reality is impossible to communicate to everyone exactly what the existing status is in the instant. So I don't know that it's even an achievable objective to be fully transparent as we're talking to one another beyond doing this. Representative Irf, do you have a comment?
Andy. Thank you, Mr. Chairman. I have a very different perspective. I view this process as being very similar to what we went through 2 years ago. The only confusion that's being created in the public's eye is what our committee is creating. I fully expect the people testifying this afternoon, which hopefully I'm going to get there in time, would speak to the governor's budget. That's what I would be doing. That's what I would expect them to be doing. That's absolutely would work perfectly. If you looked at the document that I provided, you'll notice that I've noted where the governor's elements have picked up in the underlying document. And as the chairman has mentioned, we're planning to vote on a whole bunch of accounts soon that will pick up the governor's part of the budget. I don't view there'll be any more work for the LBA. Why would they be doing anything until they'll tell them what particular account is going to hold? Is it going to hold the governor's numbers? Is it going to hold budget of 21 numbers? Is it going to hold other numbers? I recall going through and changing many of the governor's numbers 2 years ago. And that was all after the public hearings. So the public comes and they tell us what they do like about the governor, what they don't like about the governor. We're just basically looking at it from a different starting point, I guess you could view it that way, because we have to reduce. 2 years ago, it was all about increasing. So it was a different role that we were taking, I guess. I don't see the need to post this budget. It's not a budget. It simply shows two different perspectives and how they can be combined. It doesn't say that this is how they are combined. So we will basically be able to pick and choose. And we can pick a third way, just as 2 years ago, we often picked a third way. It just happened that 2 years ago, it typically was a much higher way than the governor's budget. This year we have to go lower. So I don't know why you want to confuse people about look at some other thing than what they're thinking about.
Let's not imply intent, Representative Irf. We're just hearing questions from everyone, but let's not assume that we know what their intent is.
Okay, I apologize. What word did I use that implied intent? I didn't mean to. I take it back. And honestly, I'm not trying to imply intent. I'm just.
Oh, I know. I just trying to keep it, collegial.
Well, I'm just listening to the discussion, having been through this myself 2 years ago. And I don't see the points that are being made being different from what it was 2 years ago. Other than I understand where we're starting from. 2 years ago, we started from a different place. but from the public's perspective, it's always the governor's budget. Okay, I'll just stop, I guess. I've got to get going anyway. To get the
I'm gonna try to wind down in just a couple of minutes because I have to finish getting dressed and drive up to Concord. So Representative Wallner, please share with us what you're thinking.
Well, I just have one further question, and I'd just be interested to know, has this new way of doing the budget been discussed with the governor? Is the governor's office aware of how we're going to proceed? Because I know that in the past, when the governor's office has been really involved in watching the House and working with the House around the budget. So I just wondered if the governor's office has been actively participating in this new way of going forward.
So two folks from the governor's office accepted our invitation to talk to the Division 3 leadership about, I don't know, it's been 3 weeks ago. And one of them is in the attendees now. As I've watched over the last few days, it seems like one or both of them have always been in the attendees list. I made an overt request for them to participate in our process. And the essence of the answer I got back was that the governor thinks we're going to have more revenue. We've based our budget on that revenue estimate. And the House, you have a different process because you use different revenue numbers. And we are in no position to help you figure out what numbers you're going to use other than the governor's numbers. So requests were made, assistance was not, I'll just leave it there. So to answer your question, I think the governor's office knows exactly what we're doing and why we're doing it. And they were invited to participate as assertively as they wanted to 3 weeks ago.
Thank you.
Yes, ma'am. I think at this point we have to go because some of us need to get to Concord. I'm not seeing any hands up in the attendees or amongst the committee members. I just would assure you as colleagues, I've always expected that we're not going to agree on the final numbers, but I have always wanted to have this being a very open, very transparent, and very collegial process with everyone. And today, I think we maintain that, even though we can start to see that we have different viewpoints on the way things should be. So I appreciate everyone's courtesy, and I apologize if I was a little tenser than I should be. So not seeing any further comments, I think we're adjourned. And then wait a second, before we adjourn, we're getting together at 1 o'clock today, obviously, but then we have a budget work session tomorrow where we've scheduled talking about sections 21, 23, 24, 25, 28. And then I have a note here, lapse rates, Kevin. Do you know what that note means, Mr. Ripple?
I'm not sure.
I think that meant you were going to tell us about, teach us another time, one more bite at the apple on how lapse rates get factored into the budgets. So if we say $1 billion, but you have to lapse $50 million, you know, how that has worked historically. I think it's a tutorial.
Sure, sounds good.
All right, so I'll see you all shortly. With that, today's hearing and meeting is adjourned.